ability. And so that's one nice thing about academics, or maybe it's just a crutch, but nevertheless, I view it as a positive. I think there's more fluidity, meaning you can build your practice and change hospitals to another university as opposed to building your reputation in a local community under the name on the front or the back. I can't remember which side that goes on with the name. But anyway, you could build up your, which one is it? Is it the back? It's the back. All right, so you build up, I'm Dr. whatever, and then you can't really move on, or at least there's a difficulty doing that. And so it gives you some flexibility. You have time for research. You have a national community. It's familiar to all of you, right? You're all doing residencies and fellowships. Largely, that's an academic environment. You have help from the house staff. We'll go over the flip side of this in just a second, and you have the ease of referrals, meaning that these are sent to the university and not necessarily to you. On the flip side, there's a teaching opportunity, but you keep teaching the same thing over and over because every month there's somebody new. You can specialize, but yet you got to take general surgery call or trauma call or whatever you have to take in your individual institution. There's fluidity and flexibility for you, but that basically means you're interchangeable with anybody else because it's not you, it's the university, and so that gives you a little less job security. There's time for research, but you could also argue there's really no time for anything but work. You have a national community, but on the other hand, you're kind of forced to climb the ladder. It's familiar, but you could also argue it's just the default. It's settling for what you know and not looking beyond that. You have help from house staffs, but there's also these intermediaries who are kind of sometimes messing things up for you. You've said something to the family, they tell them something else, and all that sort of thing. So it's not always a positive. And then there's really no one to whom you can send your complications, which this never occurred to me until about a year into practice when I realized I was taking all these patients that were really, complicated from elsewhere. And then when I had one, I started thinking, is there any way I can call Dr. Rickers, or what can I do with this complication? All right, so how do you know if an academic job is right for you? I think the hardest part is you have to know yourself, which I have no advice on how you should do this, but separate this from others' expectations of you. Many of you may be expected to go into academics because of where you've trained. That won't help you at all once you start, so separate that from your own sense of who you should be, and also who you thought you'd be potentially when you were a medical student or a first or second year resident, and try to figure out what you want for now. Think carefully about your priorities. So these are kind of the boxes in my head: clinical practice, teaching, research, family life. Try to figure out, does yours look like this? Does it look more like that? Does it look something like that? And this will obviously change over the course of your career. So you may start out looking more like B, but by the time you've had your second child, maybe C is looking a lot better. So you may have to think about this not just at the time you're looking for a job, but over a period of time. All right, so let's say you figured out that an academic job is right for you. Is this particular academic job right for you that you're looking at? I would say one important thing is to find out the institutional priorities. Now, the list is huge. I listed some of them here, but is the institution's priority research dollars, notoriety, patient safety, patient satisfaction? Are they really just interested in academic prestige? And how do you know these things? I really don't know, except that probably you should ask. That actually works reasonably well because they have well-articulated priorities, but these aren't necessarily going to be reflected